picture, put it on Facebook and tag me so my wife sees that I'm wearing it, and then I'm going to remove it, alright? Because I FaceTimed her and my kids this morning. I'm like, I'm so uncomfortable wearing this. I'm not going to be able to talk. And she's like, oh my God, if I see a picture and you're not wearing it, don't come home. I'm like, all right. So we're going to have some fun. This is, I am very blessed to, yes, be first off, an epic husband and dad to 4 beautiful little ones. I guess I don't actually have, we're talking nerd stuff here today. I don't have any pictures in there. So if you're joining with us at the Nilo tonight, I have a few for that. And I had rockin' practice. I've got 3 awesome docs that work with me. And that is a ton of fun. And this is crazy fun. I have another passion within those passions, and that's to exponentially expand what I get to do for a living or a job or work. I always have to finger quote those things, because what we're going to talk about my whole time with you, holy crap, is it fun. It's just, and is it a great living? Is it a great job? Yeah, absolutely. But is it a great calling? Is it just something where you can really let your passion lead you? Absolutely. So I'm assuming I'm kind of speaking to the choir here, right? Because we got a Just Club and Peace Club. So you love to adjust, and you like to adjust a lot of kids. Everybody in for that? Okay. So what we're going to do within all that stuff is I get to travel and speak. I love all of it. I like talking about, like, we're good at marketing our practice, I guess. I know how to do Facebook ads and fill up workshops and all of those things. And I don't mean to minimize any of them, obviously, and go through that. But what I do love, if I could just like stay in my lane within my lane all day and talk about and teach one thing, it's this nerdy stuff. Look at that word, analysis and interpretation. Anybody else think those are like sexy, cool words at all? Anybody else nerds in this? Okay. And now I'm in school. I like wearing my backpack, hoping that you guys think I'm still a student and I could just sit in class and maybe not microbiology or stuff like that. I'm good with that. But I just love this because this is where, and what we're going to talk about today. I'll cover that later. See? How long did I even make it before I dug myself a hole? 2 minutes? Oh, goodness. All right. So, I should fair warn you, if you've never heard me speak before, the jacket is just to cover up my unprofessional, way of speaking. No, it's, I have a lot of fun. I let my passion lead, and we get, but I'm very nerdy, very scientific, very neuro-subluxation-based chiropractor in all that we do. So if I could teach and talk about one thing, it's this today. So I'm very, very blessed, and I'm very thankful for the opportunity from the amazing club leaders at Adjust Club and Peds Club, and very thankful for each of you guys for spending these 2 hours with us and being here, because we're going to dive into this, and I'm going to hold nothing back. I talk fast, I talk furious, and I'm going to just give you as much as I possibly can about pediatric analysis and interpretation, because this is where the rubber meets the road. Now, that's not, again, my little intro there. I'm not trying to minimize. You got to know what you're doing in running a practice and marketing and communicating. In fact, those are essential. And you could make the old argument, chicken or the egg. None of this matters if you can't do that. You're not going to have any kids on the table. You're not going to have any kids in your practice if you can't communicate and deliver chiropractic and connect the message to your community. And especially in our world, in the world that you guys are looking to go into with peds and family care, to moms. It's really all it's about. You don't need to learn how to communicate with dads. They're useless. They don't make any decisions in the family. You just have to learn how to communicate, not when it comes to healthcare. If anything, they try and get in the way, and we've got to get through them. But what I'm getting at is this is where the rubber meets the road. Okay? Again, we do a lot of great things with our practice and with our work as far as getting the message out about chiropractic and marketing and all those other sort of things. But nothing speaks louder than results. Okay? I really want you to take that one home today. Nothing will ever be louder than results. You know what the majority of our Facebook posts are about? Kids who are getting kick-ass results. You know how they're getting I'll spell it out. I'm having 4 little kids. You know how they're getting amazing results on that? Because we're really good at this, okay? We're really good at delivering the goods, all right? And we have worked our tails off. It started when we were in school, showing up for extra assemblies and extra trainings and extra seminars. And it continued to what we do today. We push ourselves. That's the joy of having a group practice, of having 3 other PEDS certified, EPI-PEDS trained docs in our practice. We push ourselves to be better and always get better with our analysis, always get better with our interpretation and our delivery. And I hope you guys always continue to do that. So, now within that, I'm going to flip most of our discussion today. We're not going to do, there will be no demo, there will be no dolls, okay? Of course, that's always a good way to learn adjusting. And I want to, the tricky thing though, especially in a pediatric practice, and especially in a perfect storm practice like we have, and if you haven't heard that before, that's our brand within our brand. That's autism, ADHD, seizures. So we call them Raging Bull kids, all right? Meaning they don't always lay down perfectly on the table and you go, little nonverbal 3-year-old Johnny, turn your head to the right, okay, relax. That doesn't happen, right? So the one thing I'm going to really try and drive into as well today is to not be mechanical in your work, okay? My case history myself on this, I started off, I was a patient of one of the best. Remember, we have science, we have philosophy, we have art. And there is a very technical aspect to our art, and a lot of times we have to teach it that way. That is where you'll get through school, that's where you'll get through a lot of other places, and that's good. That's how I started. You have to learn the anatomy, you have to learn the setups, you have to learn the delivery. That's all important. And then a lot of times that more rigid, mechanical, analytical system in a pediatric practice goes out the window. So now what are you left with? So that's where a lot of chiropractors get stuck in their heads because they're not letting their hearts go along for the ride, and they're trying to be too mechanical and too analytical with their adjusting. I was that way. I was trained in a very mechanical, very segmental-based technique, and I stayed in it for a long time. That was my initial chiropractor. That was what I got adjusted with. That was what gave me great results. That's what still gives the world great results. And then I tried to overlay that into this practice that I drove, I hear a little more of that story if you can make it tonight, that I dove headfirst in because it sounds crazy. I've been in practice 9 years. But in that 9 years, autism, ADHD epidemics have absolutely erupted in this country. I mean, not like Zika and measles. Those are huge. But it's, there's like 3 of those people. And like 3 million every day who are struggling with autism, ADHD, and everything in between, right? So that's when I flew into this. I said, all right, well, where I'm stuck with this kind of rigid, mechanical, still memorizing, A to B to C sort of things, it's not working for these kids. And I'm not able to serve them and unleash the power of chiropractic by unleashing myself to just get my hands on them and serve them and take care of them. So what I'm going to do today is work with you guys less on the end point, the back end, which is the thrust, okay? And I'm going to work with you the whole time, honestly, on how you get to that point. Because how you get there determines what you do when you're there. So we are going to focus really on the other A that sets up the greatest one, the analysis. You cannot be a great adjuster unless you are an absolute, phenomenal, unbelievable analyzer, okay? So if you can kind of read the screen, that middle quote there, that's really kind of what I'm getting at with this. The thrust, the end point, again, it's the thing, it's the magic, it's where it happens, but there's so much that leads up to that. And what I'm telling you is if you get too caught up on the end point, you'll miss the beginning. And what I really, especially if you want to see kids in your practice, we're going to get you to think a lot today, okay? And I'm going to encourage you to be an intellectually based chiropractor, not a mechanistic, mechanical chiropractor, okay? Because mechanistic, mechanical chiropractic, it's probably okay for shoulder issues, and it's probably okay for musculoskeletal issues, and it's probably okay for biomechanical segmental lesions, but that's anything but what a subluxation is, okay? A subluxation is so much more than that, and a subluxation in a child who has been through the perfect storm is absolutely more than that. So you need to be a bad ASS at your analysis, and it will make your adjusting so much easier. This is, I'm going to throw you for probably a little bit of a loop right away. This is what we shared. The person who really I feel like is my technique, my adjusting. And again, when I say that, I hope this resonates. Really what I mean, he's an analysis wizard, was the doc that I got to do my preceptor with. Dr. Mike Cody is his name. He's been in practice over 20 years, crazy busy, philosophy certified, pediatrics certified, and more importantly, just experience certified, okay? He didn't just have the initials, he had the experience in practice, on the tables, seeing a lot of kids for a lot of years. And I call him the wizard, because literally I'd be like stuck with a case in like my first year or two of practice, and I would just call him and like tell him the kid's name, and he'd be like, oh, that's C2PRS if you just use a clockwise torque. Those seizures will go away. Like, you're a crazy bastard. That doesn't make any sense. But I'll listen, and I would go do it and adjust it and be like, all right, you're right. And here's where I'm going. What he would tell me all the time is he said, if you watch, and this frustrated me, guys, because I was a mechanical, like, checkbox, 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 then get to the endpoint adjuster. And he told me this. He said, if you watch a good adjuster adjust, and you ask them, and this is what students do, and you should do, and you ask them, why did you adjust that? That good chiropractor, that technical-based mechanical, but again, that doesn't mean they leave everything else out. I'm just saying they're rooted in that. They will say, well, because this, and that got me there, and they'll explain it in a very linear sequence, okay? And then he would tell me, and if you follow a great adjuster, and you watch them, and they deliver an adjustment, and then you go, hey, doc, can you tell me why you adjusted that? They go, because I needed it. That's it. I don't know, because I did. And as a student, right now, you're like, oh, so what the hell are you going to tell me with the rest of these slides, right? Just hope and pray, and all will be good? No, it's not a very good strategy. We are hope dealers, but that is not what I'm saying on your adjustment. What I'm going to give you is as much cheat codes as you can get there. But I just want to, if I can drive anything home with you guys today, it's that you have to be intellectual, you have to be understanding, you have to be analytical, and you have to put a lot of tools in your kit when you see kids, because any one system isn't going to fit 100% of kids. It's only going to fit 100% of adults. Our work, chiropractic's philosophy and science is rooted in adaptability, and I see chiropractors leave school in rigidity. And I see them go into practice in a rigid, stuck, mechanistic world, and then they want to see kids because their heart leads them there, and they get paralyzed. I'm telling you, you have to be adaptable in your analysis, in your technique, and your delivery. And when you do that, and you worry less, I'm cheating with one of the steps we're going to talk about today, and you worry less about being perfect, and you just are always obsessed in being excellent in the work you do because perfection isn't attainable, that's how you'll get to it. All right? Okay, so let's kind of break apart those words for a little bit. So what is this? It's my favorite word. I don't know why. I'm such a nerd. Interpretation, all right? Because it's the middleman, all right? It's where you take all the information you've been given and you've gathered, okay? That's called doctoring. But that listening, seeing, hearing, examining, all that sort of stuff, and you, the doctor, make the clinical decision that says, this is what that means, this is what I'm going to do with it. Out of the dictionary, it says the action of explaining the meaning of something. Anybody know what that something that we're going to talk about the entire 2 hours here today is? Subluxation. All about subluxation. You are going to be subluxation, CSI, hunters, destroyers. That's your job, all right? And then this is a big part of it too. An explanation or way of explaining, okay? I'm going to give you as many data points as I can. And again, not necessarily the main topic of today, but remember, it's only so good, it can only deliver, you will only get to that point of making the adjustment, the end point, if you can then also articulate and communicate that to your community, to your patients, to that mom who has that little baby, who's having seizures, having ear infections, having colic, and wants you to make sure that they have an epic life, okay? So interpretation is, yes, internal, okay, be the doctor, and we're going to take you through that, but then you're always going to have to match that to explain that, articulate that, communicate that, because the parents and your patients are going to know what you found, what it means, what's your plan, how's it going to work, all right? And that's just simply the questions you have to answer with communication. All right, analysis defined. So the analysis, the definition of analysis is a detailed examination of the elements or structure of something. So there's that something word again. So we are hunting down subluxation today, typically as a basis for discussion or interpretation. All right? So I bolded the word elements there because I want you to know there is many elements that you can use for your examination and your analysis. They include your head, they include your eyes, they include your ears, they include your hands, they include scans. We're going to talk about those today, and we use them mightily in our practice. I literally I could, but not to the degree and the excellence that we deliver now. Without scans, couldn't practice the way I do today. So this is huge. Now, I want to take a quick little 5-minute sidestep, might not even take that much, to let you know that the best way you can become an awesome pediatric subluxation analyzer, and therefore adjuster, is you've got to know the science behind the subluxation inside and out, okay? You need to know everything there is to know about that little SOB, all right? You need to know what that thing does, what it looks like, what it creates, what the effects are. You need to be able to hunt that down. And that's what our science gives us, okay? The science explains that meat, right, as to what's going on with the subluxation. And the greater you understand the science, see, that's what happens. Sometimes people think, oh, I'm a philosophical chiropractor, and they think that philosophical chiropractors don't care about their art and their technique. That's anything but true. And then a lot of times they think, oh, philosophical chiropractors don't care about science. You can't unseparate any of these, okay? It's not a three-legged stool. They are intertwined. They all set each other up. So the greater you understand the science, the greater you will be at the art, okay? And again, within the art are those two A's, analysis and then the adjustment. So really quick, the elements of the subluxation, you must know the subluxation is not it is not just only physical. It's not just a structural entity. It is not just taut and tender fibers. It's not just a bone sticking up high so you just mash it down, all right? That's not the subluxation, okay? The subluxation, does it have biomechanical, structural, spinal, muscular, ligament? That's about as far as I remember anatomy. Components? Yes, it does, okay? The spine is our entry point. It's our conduit. So does the subluxation include the spine? Absolutely. Does it include misalignment? Absolutely. Does it include fixation? Absolutely. But does it include altered, interfered, messed with, jacked up neurology? Yes, it does. And is neurology the boss of the body? Yes, it is. You like that, Shelby? Boss? Right there. All right. She called me a boss this morning. I'm like, that's awesome. I call people bosses because I'm just horrible at remembering their names. No, I'm kidding. So when I call you boss or buddy, no. But what it comes down to is the nervous system is the king. It runs the entire it's the whole operating system of the body. Now here's where I'm going. This would be, and again, I'd love to come down maybe next Friday and I'll teach 2 hours of science because it's my other favorite thing. But there is multiple components of the subluxation that go way beyond crooked bones and pinched nerves, okay? The subluxation is a neurosensory, it's a perception and interference-based issue, okay? So the 5 components, we like to teach subluxation, and again, this is a 10-hour conversation. I'm going to give it to you 2 minutes. But the 5 main components of subluxation you need to be aware of, they all start with D, so they're a little bit easier to remember, and there's more of them, is first, yes, dyskinesia, right? So that is abnormal, that's the kinetics of the system, right? So abnormal alignment, and here's the key. When you have abnormal alignment, you have abnormal or reduced movement, okay? You can't separate those two either. Now let me ask you this, and again, cheat, hopefully, if you've already studied and been through this and gone through this, and if you haven't, keep going, keep learning. Which of those components, the misalignment, so if you take dyskinesia and you separate it into the 2, misalignment and fixation, which one of those 2 components really messes up neurology? Fixation. The lack of movement, right? Because the brain and the nervous system, and therefore the body, are charged through movement. It is our electrical, energetic system. It is hardwired for movement. I wanted to pull that out and illustrate that because that is that is more important in kids than anybody on the planet. Their movement of their system, specifically the spine, specifically the upper cervical and the spine, has everything to do with their brain development, and their brain development has everything to do with their health development. Movement dictates brain development, organization, and communication. Okay? So when movement is altered early in life, aka subluxation, or before life is out on the outside, abnormal, prenatal pregnancy care, in uterine constraint, breech positioning, when subluxation exists, movement is altered. When movement is altered, brain function is altered. Why? Because the other D's, disafferentation, okay? So abnormal input. Here's another big thing, and again, maybe more the topic of conversation today. We need to upgrade. You know how anybody have a new iPhone? The new iOS, the new iPhone 7, everything is upgraded, right? You were just saying all this has been upgraded. We need to freaking upgrade chiropractic, guys. It's your job. This generation of chiropractic needs to upgrade. Not just we've upgraded our understanding of chiropractic, so we need to upgrade our communication and our delivery of chiropractic. That's what I hope I can do for you guys today, is upgrade your understanding. Not so it goes in your notebook or goes in here, but so it comes out of here in your community one day and you do a better job taking care of kids and families, okay? We need to upgrade chiropractic because it's not a pinched, hose, or a pinched nerve. I can't even explain those sort of analogies because they're outdated, okay? And the world knows that, which is why we haven't caught up to the world. So disafferentation is that second D, and that sets up a whole cascade, and we could go on and on and on. The main one is dysautonomia, that really wreaks havoc on the health and well-being of kids and everyone. Then you have dysponesis, which is abnormal energy output and control. Sound like ADHD, maybe? Sound like sensory processing, OCD. Sibling defiance disorder is now a diagnosable, therefore drug-inducing, what do they call it, diagnosis. Okay? My kids have sibling defiance disorder. I have a firstborn girl, which means I have a boss of the family, all right? So anybody who's not falling in line with Addison for a moment, that's sibling defiance disorder. Thank God we have, I don't know, what is that, Zoloft that would handle that? So, but that is it. Dysponesis is really what's wrecking our world. It's wrecking our kids. We're going to talk a lot about those kids today, those raging, bold, perfect storm kids. And a lot of, and this is the big one, this is the fifth component. So if you're taking notes, it's dyskinesia is the one that that we've kind of talked about forever, right? The abnormal alignment. You look for it on an x-ray, you feel it with your hands, yada yada. Still a part of the equation. Can't be left out of it, okay? So it starts there. Dyskinesia, then disafferentation, then dysautonomia, then dysponesis, and the fifth one is the resultant. All of these are kind of one on another. They're all culminating from each other. The fifth one is what's wrecking our world, and I thank you for showing up here today so that you can go out in this world and start to reverse this. It's disconnection, okay? And I add that fifth one, the mentors who taught that to me, by the way, it's a big thing for me. From 99% of what I do every single day is learn from amazing mentors and people who have come before me. And in the science world, where my certainty came from, because no matter whether we're talking about analysis and adjusting or communicating, it's your certainty that will blow up your pediatric and family practice, and that is the trump card above everything else. And mine really came from science, because I'm a science guy. So James Chestnut, his book, Dr. Christopher Kent, Dr. Dan Murphy, those are the ones that really put this out there with this 3D, 4D model of subluxation. And I want you to Google it. I want you to buy that book. I want you to go to a Dan Murphy seminar. You must know that stuff inside and out, okay? And the fifth one, though, the disconnection, yeah, it's neurological. Disconnection makes sense with subluxation, right? Interference in coordination leads to disconnection of how the body works. But theoretical, and then I promise I'll get done with my long, winding intro here, and we'll get right to the meat of this today. But disconnection is what's destroying kids' lives. It's what's wrecking their families. It's what's wrecking school districts, bankrupting school districts, paying for all these kids and all the therapies they need to try and just make life better while subluxated instead of get to the root cause and deal with it. So disconnection is really where kids in today's more stressful, more chaotic, more toxic world than ever, because they're disconnected, because they're subluxated, their ability to adapt and be resilient to the world is worse than ever. So kids today are getting hit from both sides of the coin. We live in the most stressful, toxic, accumulated, destructive survival value world ever, meaning our kids need greater adaptability than ever. So a perfectly functioning nervous system would be a pretty important thing for that. But because of what we do to them early in life, especially during pregnancy and birth in the first few years, they are more subluxated, more disconnected than ever. So their ability to overcome all of that stress and toxicity that's in our environment leads them to be sicker than ever. That equation right there, which honestly, if you just break it down to its brass tacks, is math, right? The whole argument of 2 to 3 T's caused up. Where's Dr. Russell? Did he make it in here today? The 3 T's. The more you know what they're going to do to the nervous system, and thus the physiological, thus the biomechanical, thus the structural system. See, remember, your job is to hunt down subluxation. So know what it does to the body so you can trace its steps and go back and find it. That makes sense? Anybody confused on why that matters? Okay. All right. So what I chose to do today is I'm going to go through 5 or 6 of the common mistakes I see. So when doctors come into our program or I'm talking with them and going through, when it comes to taking care of kids, the 5 most common mistakes they make with adjusting and analysis, and we're going to teach them to you because here's what I want you to do with them. Flip them on their head and do the opposite, right? That's why we're covering them in kind of the negative connotation, if you will, first, and we want to flip them around. Guys, chiropractic miracles still absolutely exist. They're everywhere. Okay? The sign that's been above my door at my practice and will be there forever, no matter how big we build it or where we put it one day, will always be a simple little epigram that says, expect miracles. Okay? That way they see it when they check in, and that way they see it when they walk out. It's what I want their mindset to be. Now here's the reality, because of the perfect storm world and the little math problem I just shared with you. It's harder, it takes more work, it takes greater skill set, greater commitment, and a bigger care plan. I'll expand upon that right here, to get those miracles than it ever used to. Okay? And that's a big thing. So what gets you those miracles, guys, is not just the greatest of thrusts, not the greatest of adjusters. What we've really figured out over our time taking care of these kiddos is the greatest results come from the greatest care planners. Sounds so boring. Sounds so like, wow, what the heck are you saying? And here's the biggest issue. This is why I put this in number 1. Okay? What I find, and it pairs into number 2, you'll see in just a minute. What I find is that when people step into taking care of kids, because of their lack of certainty, because of their fear mindset, because they don't think the public will buy chiropractic, so especially maybe a mom for her kiddo, so they just say, that they minimize the amount of care that they recommend, okay? And they keep the care plan far too short. Or in another way, this is a big issue even within, kind of the pediatric division of our profession, we have to upgrade our care plans from where they were in a couple of decades ago, when honestly, just going to call it how it is, the world wasn't so subluxation inducing as it was then, okay? So you have to understand, again, this goes back to science. The subluxation is a neurological habit, okay? When it forms, and it's forming earlier through pregnancy, through everything that's happening with pregnancy, now we're delivering kids via forceps, plungers, emergency C-sections, inducements, all these other sort of things. Then as soon as they show up, we shoot them up with, maybe some Hep B shots just in case they want to get frisky with the heroin using baby in the NICU next to them. And then we just keep going, right? And we keep adding stress and toxicity to them. So what are we adding to them? What are we burying? Their ability to adapt. What do we call that? Subluxation. So it's showing earlier, more often, and nastier. It's getting deeper into the hardwiring. That bug, that glitch, that neurological perception, interference, incoordination inducing issue is in there deeper, bigger, bolder, badder than it ever used to be. So 2 times a week for 3 weeks, 1 time a week, and then once a month from there, and we'll see how it goes, doesn't cut it, okay? It doesn't cut it. You can't hardly even take care of something simple like ear infections with that, okay? And if you want to get into this perfect storm world, and if your heart is leading you and saying these kids are being ravaged by autism, they're being destroyed by ADHD, and I want to go out into my community and reconnect and restore those kids so I can restore those families and restore these communities, then you need to upgrade your care plans, okay? You don't just need to become a better adjuster, you need more adjustments to get the job done. This is neuroplasticity. Subluxation is a neurological habit, and a bad one, a negative one. It's your job to outpoint it and outpace it. And if you wuss out on the care plan, you allow that subluxation. Maybe you beat it down a few notches, and if you walk away too soon, it comes back to life, and that kid's life is again interfered and wrecked with. Your job is to put a care plan together. That is the single most important thing that we train our new docs and our interns and our students on. We don't send them out with a dry spine and a bilateral weight scale to the mall so that they can go get new patients, all right? We make damn sure that whoever is coming into the practice, they're going to be really good at taking care of them. We teach them case management, case interpretation, and care planning first. And the reason I teach it first is I think it's our biggest subluxation, so I put it number 1. It's the number 1 thing that chiropractors are missing out on to get the results they need with kids. And 2, and it's just the way it is in the world right now, it's the number 1 thing not really being taught anywhere else, okay? We have like case management, I can't even say this stuff straight, like for sciatica, I don't know what they are, but they're out there, right? They're set up by most of the insurance guidelines, right? 8 to 12 visits till their pain goes away, the insurance stops paying, and what do? Go away, okay? That's not what you guys can do when you get out and take care of these kiddos. So the number 1 thing you need to understand is the care plan frequency needs to go up, okay? You've got to hunt down that subluxation. And here's how I care plan, all right? First, listen. I'm going to put these in kind of a summative order for you at the end. First, your job is to take a case history, not because boards told you to, not because your class told you OPQRST, not because the case management group told you take a case history and memorize the script and then say that, or sorry, practice manager, whatever. But your job is to take a case history because you're going to be a doctor, okay? And that patient is going to have something going on, and it's your job to hunt down why it's happening, because you're a chiropractor, you're a doctor of cause, and then do something about it. So the first thing I do in the case history and through our paperwork is I listen for every little attribute of that subluxation process there is. And really, guys, and I'm going to try and just, I hope this gets pretty simple, because it's complex, but yeah, you got to make it simple. I'm adding it up, okay? I'm not a symptom treater. I'm not just listening to their case history to sound how bad their symptoms are, and I'll match their care plan to how bad their symptomatology is. But it's really actually more simple than we in our chiropractic freaking over-analytics make it. Guys, the nastier the symptomatology, 9 times out of 10, the nastier the subluxation. Because it's caused more havoc on the nervous system and thus the body, okay? So you can start to quantify these things. And then far more important than that is the objective analysis we go through. Your hands, your examination, if you use scans, they are to do one thing: quantify the depth and severity of that subluxation or subluxations. Okay? Your job on day one is to quantify and determine what you're dealing with. How bad is the subluxation process, and what this kid's nervous system, how bad is it? That's why scanning technology, oh my God, talk about taking the complex and making it easy. I'm blown away that we have a profession that talks about changing the nervous system, which is a live, energetic system, not a black and white 2D system. And we talk about changing the nerve, we talk about subluxation interfering with the nervous system and our adjustments making it better. And then most chiropractors are afraid to actually measure that. So they cop out and they say stuff like, oh, it's not reliable. No, your delivery of the goods isn't reliable. That's why you don't do it. Okay? A little tangent important that too. So now in my farmer crazy short man syndrome way of care planning, all right, here's how it goes. I measure up that subluxation, and then my job is to put a care plan together that is going to beat that SOB lifeless, all right? I want it laying on the ground, bloodied and dead, so it can never destroy that kid's life again. I'm going to pretend like I'm going to walk away. I'm going to walk back and kick it in the head like 3 times a week for 2 more weeks, all right? Just to flush it out. I am the king of overutilization, okay? Absolutely. I hope maybe some of those compliance people and insurance people, if they ever would like an example of overutilization, I'll be happy to come to their seminar and be their test victim. Because you know what? I don't freaking live in a white paper, and I don't live in a journal. I live in a community. I live in the world of practice, okay? And I know what it takes to get kids better, and I don't hold myself to anything other than that. I don't care what somebody says on Facebook. I don't care what I know those things matter. Trust me, I do. And we're working hard to make them better as well. But your job is to get that kid better. And if anything, overshoot it. If anything, oversell it. If anything, buy yourself time. And I'm going to move on to the next one, but I have to put an important extra asterisk on this one, especially as students. Man, I wish somebody told me this when I started out my practice. Because here's what your head will tell you. Because are you going to be as good at adjusting when you graduate as I am 9 years later? No. Is that okay? Hell yes. All right? And you know what? The best chiropractors, you'll never catch them. Use them as mentors. Use them as leaders. You'll never catch them. Because if they're really actually good, they're going to keep improving. All right? So you're only responsible for you and moving you forward. But when I started practice, my head told me, I'm young, I haven't developed, I don't have the brand, I don't have that sort of stuff, so I don't think that patients will buy these bigger care plans, right? I don't think they'll go for that. So I minimize my care plans at a time that it's just math. I needed more time to get that kiddo better because I wasn't quite as good at delivering the goods as I am now, okay? So please put an extra asterisk on that one. And guys, when you deliver it with authenticity, with sincerity, when you have science, when you have everything backing you up, trust me, people will go into this. Because if you want to build a practice that has nothing to do with third-party pay and nothing to do with all the traditional crap that chiropractors do with, build a pediatric and family practice. And I'll call it how it is. It's an unfortunate reality. But it's also, it is what we do. You got to have a living, and you got to go back on your student loans, and you want to be successful. It's an unfortunate reality, but the perfect storm population, ADHD, autism, and chronically sick kids, they will drive any distance and pay any fee. Okay? Literally yesterday, we had to have a conversation. We didn't even get the job done. They're still going to come to us. It's awesome. They modified their plan. We have a kid, a spectrum kid.
His mom, they heard about us on Facebook, another person over here. I mean, we get emails from India and other countries once a week looking for chiropractors for our work. But the spectrum kid who is locked into autism, I shouldn't say that, he's been with us for 2 months. He's unraveling and making his way out of autism. Drives to us from Springfield, Illinois. It's 3 hours drive, okay? He not only drives past a lot of other chiropractors, they even drive past other epic pediatric chiropractors. Some of my best friends who I've trained and I know they can deliver the goods. But our certainty was at a place that those parents just said, money's not an issue, time's not an issue, you just tell us what we need to do to get our kid here and we will get him better. That's the level of practice he can build. Do you think that Blue Cross Blue Shield is anywhere in that conversation with me and that dad? No, okay? It's not at all. And here's the crazy thing. Here's why it's nuts, all right? I'm such a technical guy. My whole team is. Right now, we've cleared, this is how we kind of teach adjusting and going through it. Upper cervical is boss, okay? That's where the majority of proprioception, the vagus nerve hangs out there. It's kind of next to the brain, so even just geography, you're like, oh shit, that's probably important. So that's a very important place, right? All right? Sometimes I went complex, and then I'm blessed to be a farmer. I just simplified that kind of thing. So sorry if it's a little crazy here today as I go back and forth between this. But literally the kid, we've been under care for 2 to 3 months. And he's progressing. We got his upper cervical clear. We've been working through his thoracics, his adrenals, and other areas. And right now, his sacrum and his gut and all sorts of other things are just a mess. I mean, our scans, our hands, our evaluation, our posture, everything, all of our analysis is showing his sacrum. And we just can't get it to clear. And so we're stuck with it, right? And when you're stuck, we usually change the care plan or you change your technique, okay? I don't have a technique, by the way. I use T-squared, Tony's tonal technique, all right? That's my technique, all right? There's no seminar, you can't attend, all right? I love teaching analysis, but I hate teaching technique because people think it's mechanical when it's not. So the reality is this kid is stuck at the sacrum. So we entered the conversation in the progress report yesterday. We're like, we need to change something because he's sitting in the car for 3 hours. Both ways, right? Not so good for the sacrum, right? And so we're starting to figure out that maybe that's why it's holding its pattern. So we literally start to say, all right, so one of our other epic docs is literally an hour over here. Why don't you just come to us once a week? We will co-manage. We've done this a ton of times with Dr. Jen, and we'll do it that way. And the dad's like, nope, come in here. He's like, can I just get a hotel? Can we just stay here for 48 hours? I'll just take Monday off, and we'll stay here. We'll come see you Monday. We'll see you Tuesday morning, then we'll drive back. And we're like, yep, yes, you can, all right? That's my point on this, though, is it just matters that you stay on the depth of that and you put that together with it. Because when you deliver that certainty, all the other restrictions and interferences that most chiropractors, and I'm sorry, I'm off on more stuff I'm probably going to talk about tonight, per se, and plan to, but that doesn't get in your way. And now circle it back to the main meat of today's conversation. You know what that allows you to do? Just be a badass chiropractor. Just focus on what actually needs to get that kid better. All the, if I say this, how I say it, how I do this, how the care plan looks, what's it going to cost, what's the schedule, yada, yada, all goes away because that population of kids, and they're everywhere, those parents want their kid back. They want to be able to look their kids in the eye and say, I love you. They want to get a hug, not a scream. They want to be able to take their kids to a water park and not just have to live in their house all day long. You want to be motivated? Go do a house call for a 17-year-old kid who's been locked into the worst of autism forever and see that they don't even have. There's no glass, there's nothing on the walls. The furniture is destroyed because the kid, as they stim and as they have stress, has destroyed the furniture, so their life has been destroyed. That'll motivate you to move a little bit beyond freaking back pain and sciatica. Like if somebody comes up to our clinic with foot drop, right, like an L5 thing, we just turn off the lights, lock the door, we're like, we're not in here. Teasing! No, we refer them out to each other. All right, so number 2 mistake, all right. This backs into the number 1. What time? I got a little glare there. Oh my gosh, I'm talking a lot here on tangents. Okay, so we have till 12:50. Shelby, is that where we're at? Cool. All right, so this ties in the other one. Now, what I think I see, they kind of merge these two together because they wuss out on the care plan and they don't give themselves enough time to get that kid better. By the way, if you really want to learn even more about neuroplasticity, there's a book by an MD named Norman Doidge, D-O-I-D-G-E, The Brain's Way of Healing. He's got a few other books too. He talks about another term, which is way more than my 5-minute thing, called diascisis, okay? And if you read that, and if you know enough about those other D's of subluxation, disafferentation, dysautonomia, diascisis, and I'm going to bring it into our epic peds and our perfect storm work. Developmental diascisis, meaning an injury. Diascisis means there's an injury somewhere within the nervous system, and the effect is somewhere else. We've looked for autism, ADHD, anxiety, and depression forever from the foramen magnum up because it looks like it's a brain-based disorder because it comes out with brain-based effects. So that's medicine, treating and chasing effects, right? It's here, okay? It's in the spine. I always tell neurologists when I talk to them, like, what do you think the foramen magnum is a closed door? Like, I don't see how the neck could affect seizures. It's freaking hanging from the bottom of the brain. Do we need to go on beyond that? It's just connected. All right. So what they do is they adjust too many segments on each visit, okay? A child's spine is not whack-a-mole at Chuck E. Cheese, all right? Every high spot that pops up does not need to be pushed down. Nobody's spine is, by the way. But this is even more important in pediatrics, okay? So what I think happens is chiropractors get out into practice and they merge these two together. They let their heart maybe get a little bit skewed and they go, all right, well, I don't think that this patient's going to go into this big care plan and yada yada. I've had all that other pollution and crap put into my head about those things. So I'll just give them a few visits and then I'm going to do as much good as I can on this visit on this table. Well, if you do too much good, a lot of times you don't do any good at all. You short circuit the positivity. You have to really understand primary, secondary, tertiaries, and honestly, most of the time, the tertiary doesn't even enter the conversation. Especially in the beginning, we are adjusting one place, one time, okay? I would much rather see you go a greater frequency of visits and a greater number of visits and quote-unquote do less thrusting, less adjusting per visit. And give that nervous system time to unravel, unwind, restore, and heal because it took time to subluxate, get sick, and have the altered tone that it has, okay? So what I'm telling you is I watch, and please, if you feel the need, and I hope after today you never do, regardless, if you feel the need to do 2 supine cervical maneuvers on a child's neck, on a baby's neck, and then a couple of random, double thenars on their spine, and then lumbar roll their L5 and their sacrum, don't put that shit on YouTube, please, all right? Can we do that as a chiropractic profession? Be like, nobody thinks that looks good, all right? It doesn't matter how well you can explain chiropractic. This is a please take-home lesson for all of you. You will never see an adjustment on our website or on our Facebook page. And we are sustained contact when needed. We are integrator. We are toggle. We are light, specific, dural, tonal adjusters. But sometimes we got to bring the goods too. If a kid's pulled out via gigantic pliers, sometimes they're really, really dyskinetically subluxated, and you might need to bring the wood. All right? So the last thing you should do is take a video of that. And again, I get it. Facebook Live video, I do them all the time. We do a ton of the story after the adjustment. Because this is a communication tip. You can't ever make that look good, especially in the eyes of a mom. Okay? It looks like Rambo. All right, I'm dating myself with that one to that. But it looks like you're about to off the child. Okay? And I see people do it all the time. There's like 3 docs in our town who recently, and this is the, okay, I'm off on time. And it's always their own kid. You want to know how a practice doesn't actually see any children? The only pictures of kids getting adjusted with their Facebook posts are their own kids, all right? That's how you know that they're not actually a family practice in pediatrics. If the only kids they ever take pictures of happen to have the same last name as them, okay? So what I'm telling you is just don't put that up. But be specific, just make sure you're not over-adjusting on a specific visit, because it's not what they need. The adjustment process, the care plan process is that, a process. Okay, we've kind of already beat this one in a little bit, analysis intent. A lot of times, guys, you can just, especially with pediatrics, we're too biomechanical. We're too structural with our analysis instead of understanding the neurological overlay that's on these kids and in these systems, okay? That's another tip for you. Every time, if you talk about immunology, I want you to forever. This is like the old people talking about, oh, you're trying to break a habit, wear a wristband thing or whatever. A trick I will tell you that will get you to understand and communicate and deliver chiropractic so awesomely is put those 5 letters, N-E-U-R-O, in front of everything you talk about. Neuroimmunology, neurogastric system, neuroendocrine systems, okay? The nervous, and it's not just a thought, it's not a practice management tip or whatever, I don't know. It is literally how the nervous system works. You cannot untwine the nervous system from any other system of the body. People talk about the gut-brain connection. When people get on Dr. Google and Dr. Amazon and they reach natural drug-free research, natural drug-free treatment for autism and ADHD, they're starting to learn a little bit more about subluxation neurology because our stuff's starting to get out there. But right now, they land on inflammation, they land on the gut, right? That's inflammation is the root of all disease. Everybody tells us that nowadays, from CrossFit gyms to Chipotle, right? They're not wrong, they're right. but they're incomplete. The nervous system controls and modulates the immune system and the gut. There is actually a gut-brain connection, or a brain-gut connection is how we teach it in our practice, because the brain is always the boss. It's called the vagus nerve. Like, literally, it freaking connects the gut and the brain, okay? And where does the vagus nerve reside and hang out? Where's its home base? Right here. So if we take a kid and do this to them, is that good for the vagus nerve? Not so much. So they need your hands. They need your analysis. They need your delivery. All right. Now, the other thing, and I'm going to get very, very kind of mechanical, but yet I'm going to keep it to the neuro on this and overlay the two together. We have to understand how these, can I finally do this? We have to understand how these kids are delivered, all right? So first off, we'll skip through pregnancy, and I don't mean to minimize that. We have a huge prenatal practice. In fact, I hired one of the best in the world so that we could blow our prenatal practice up, because I'm sick of telling the perfect storm story. I'm sick of trying to have to restore and repair kiddos. I'd like to get out ahead of that freaking perfect storm and save babies before they go down that road. So those of you that want to blow up prenatal and pregnancy chiropractic practices, freaking awesome. You're literally actually making a bigger delta and a bigger impact than even those of us like me who are perfect storm people, because you'll get there ahead of time. So I commend you for that and go after that, okay? So what we know as they go through that pregnancy and that prenatal period, there's a lot of constraints, there's a lot of, but let's just literally talk about birth, all right? So first off, let's talk about an induced birth, all right? Because the OB's got a golf game he's got to get to or something, all right? So let's talk about induced birth. So the way birth typically goes down, and again, we're going to talk about this, we're going to go very, very, very literal on this, and I want you to see it through the eyes of what the subluxation is going to look like, smell like, sound like, be like at the end. Everybody with me on that? Okay. So let's take I first have to actually contrast it with a natural, non-intervened, chiropractic supported birth, okay? Because that's the only way to have not the only way, but it's a heck of an advantage to make sure that there's no interference to the nervous system and therefore no intervention. Those are the two eyes that match up in prenatal. If you have interference to that mother's system, it's much greater likelihood she's going to get intervention. And it'll circle right back around, and that's going to lead to interference on that kid's nervous system and life. So in a natural birth, that the woman is well adjusted, well cared for, the nervous system knows what's going on, it's given its own timing, because innate knows a hell of a lot better than a chart or an OB or anybody, and it's allowed to go in a natural birth process. What happens is it begins, there's stages, there's cascades, but to the mechanics of it, okay? To the mechanics of it, the way the womb works, the way that mother's uterine wall and the muscles and everything works, is exactly like peristalsis of the gut, right? So the contractions start up high. I'm a farmer, I speak in directions. They start on the North Pole, all right? They start up top, and they start to guide that child. So the contractions work in a concentric manner, top to bottom, anatomically sound would be superior to inferior? Yeah, all right. North to south. And so they work up top, and they slowly take that child down through the different stages and through the birth canal, right? Kind of, and again, any woman here, and I always have to plead the fifth when I talk about this stuff. I am a dude. So I have observed my wife, my rock star wife, the strongest, most courageous, amazing woman on the planet, deliver my 4 kids naturally in the world, and I know how much it mattered. And so you start, and it goes down, and it's guiding that child down through the birth canal in a methodical, and I say that because especially if it's the first birth, or I would think any birth whatsoever, like 3 seconds would be too long for a dude to handle, all right? Oh my God, end the world, end humanity. But what happens, that child goes down, and it has that methodical, that forming, that molding, all of that that's happening, okay? So it guides through the woman's, muscles are allowed to contract and relax and go through the process that's needed to deliver the child through the birth canal to get, and there's even more to that, to deliver what we consider to be the innate first adjustment. You know who should do the first adjustment to that child? The mother's pelvic floor muscles, to be honest, because the head should come out, and then the child, innately, that mother's pelvic floor muscles contract, turn the baby's shoulders, not just so the shoulders can come out, not just so the fluid kicks out of the lungs and they start that, but so it literally kickstarts through a HVLA thrust. It literally kickstarts the neurological coordination and control of the cardiorespiratory and that system. So when it's missed, right, forced, induced, forceps, vacuum, C-section delivery, when that's missed, it's not just the molding that's missed, and it's not just the probiotics that's missed, okay? It's that first adjustment to kickstart the nervous system. That's why a kid delivered via C-section has such greater incidences of all VAs, autism, ADHD, asthma, allergies, and everything in between. So now even just an inducement, what happens is that Pitocin, it's like an antibiotic. It's not a smart drug. It doesn't go, oh, I'll just go to layer 1 for an hour and start working there, and then I'll make my way to layer 2. An inducement means the entire uterine wall, as soon as that hits the system, it's like a smelling salt, and it goes, phoom, and it contracts. All at once. Ask any woman who's been through an induced birth. There's a lot of pressure at one time, all together, all throughout, top to bottom, left to right, all the sides. Now be that baby's head and spine inside that, right? It's an all-out sympathetic surge of stress, and it sticks the nervous system like this. It's literally like if that baby was jolted, which would never be good on the outside, right? Would anybody let us, pick up a baby by their head with the pliers on the outside? No, you'd be in jail. Would it ever be cool for when a baby's an hour old to stick a plunger on their head and pull them around like this? Crazy ass talk, right? That I'm even saying like that? But yet we deliver babies into the world like this, and nobody goes, hey, bro, that might have jacked up your neck. Maybe we should bring in Dr. Tony and put it back on, okay? It's that freaking simple. And actually, it's the best way to teach it to people in workshops. It's that simple. So the inducement, literally, we see a high incidence of induced deliveries with ADHD and anxiety. More of what we call the raging bull hyperactive side of things, because literally in that moment, the neurological system imprints sympathetic sustained stress. Okay? It just gets stuck on. The brain is most plastic at its beginning ages and stages, right? It's the way the nervous system works is to perceive the environment and coordinate the behavior of all their cells. Well, if that's your first impression of the environment, you're like, shit, put me back in. I would be, right? It's crazy out there, okay? And so they get that, and there's a huge burden. So what we find with those kiddos is, yeah, they have rotation, they have some big atlas and upper cervical subluxations, but we find their cranial sutures, we find their cervical spine, we find their thoracic spine, we find their lumbosacral spine. We find them rigid, stuck, stressed. Does that sound like ADHD? Fear, jumping around, anxiety? Does it sound like asthma, difficulty breathing? Does it sound like ear infections because of lymphatics and nothing can drain? All an ear infection is altered plumbing and altered neuroimmunology. Okay? So that's what happens with an induced birth. So now, as you go to take care of this kiddo, here's the trick. Here's why I went on this with this slide. Okay? That kid is so sympathetically sustained, global subluxation, neurological system stuck in. If you go in and you think it's just a bone out of alignment, boom, and you try and just thrust, that system kicks you right back. Because the subluxation and sickness, therefore, is all about tone. And these kids have such a high level of just wound up tone that your too much tone kicks right back. Okay? Just like a rubber band. The further you stretch it and you go into it, the more physics you get kicking back. So when we take this very forceful, very physical, very mechanical-based analysis and then adjusting, this is why it starts with analysis. If you think what you're doing is evaluating that kid just to find where the bones are out of alignment and stuck, you're missing the whole point. Your first analysis of the kiddo, the first thing we do is we put our kid in our hands, and we just judge the global sympathetic stress. Subluxation means sympathetic stuck on. And really what it means is the parasympathetics are shut down. Okay? So you're measuring, you're assessing, you're feeling that. Now, are you going to have to eventually break that down and find your entry point? Are you going to have to find the primary and say that's where it is? Yes. So let me give you some cheat codes because you guys showed up here today. This is very, very advanced subluxation hunting stuff, okay? And it's there. And is this on a white paper because we have, randomized cohort trial? No. But do I have thousands and thousands of kids that have been in my hands and other docs like me's hands? And we see this? Yes. Because we are CSI hunters. We're not just mechanical. We look back. Now what you're going to find with a forceps sort of delivery, where they take that in, they put it around, guess where the prongs of that thing land? Yeah, right where your hands are going to need to land one day. Right along the occipital condyles, because that's meaty, right? They can hook onto that. Freaking crazy. And again, I get it. Now here's a very, 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 very important tangent. 10% or less of the time, thank God we have this stuff, right? Thank God we have emergency C-section. Thank God we have these things to get these kids into this world. Medicine is the best at crisis intervention, but too much of a good thing is like everything else. And all of those things that may save a life still have consequences, don't they? Still have sequelae to the nervous system. And who's doing anything about that? Nobody. You, one day, you have to do something about that. I will not fricking rest until we are the first resort, not the last resort, and I will not fricking rest because I've been there with my son and dozens of other babies. So there's a NICU-trained, badass pediatric chiropractor. I don't care what school they went to. I don't care where they're from. I care that they can do this and deliver the goods and that they're on the NICU floor. So when a kid enters the world this way, right away, not when they're 7 or 8 and they've been ravaged by seizures and autism forever, or like most kids, they never get to us, do they? Still not getting to us. So when they take that forceps and they deliver that kid in that manner, you got to understand there's a lot of pulling and then the twisting. And really what happens, and again, I'm a nerd, so I trace down the anatomy, I trace down the neurology, so if I'm a little too detailed with you, I'm sorry, I know it's kind of grim. But what happens is I find that forceps deliveries absolutely lead to massive primary occipital and atlas subluxations. It's literally, especially, and here's the deal, that OB is going to be either right-handed or left-handed. Which one's more common? Right-handed. So 90% of the subluxations I find in these kids, if you're a Gonstetter, or if you want to just start with listing, again, please don't get stuck there, but it works. It's a piece of it, dyskinetic, ASRP sort of subluxations. Because they take them, their right hand is their power hand, and they pull in this manner, okay? So now, if you can imagine that child's head, they take them and they pull. And a lot of times, again, this is why when we take a case history, it's important to know whether the child was sunny side up or sunny side down. It's important to know whether they use forceps vacuum. Even when they use C-section, you keep asking, was it routine? Because I've had C-section deliveries, I've had people with a mother, because the world, like ear infections and ADHD, it's just been normalized. The world thinks that C-sections are normal, almost to the point that I had one mother years ago, when I asked, oh yeah, the C-section, like, well, can you expand upon that a little bit? Was there any trouble? Did it seem like that? No, it was normal. And I just knew from the kid's case history, because he had severe torticollis and other thing in his case history, I'm like, that doesn't sound right. They literally had another nurse get on top of the table and push down on her abdomen while they pulled the child out, dislocated his shoulder and broke his collarbone. And she walked away from that thinking that was normal. So now 3 years later, the kid, had PT for his torticollis and all the other sort of things, but he had autism, right? Because that's neurological damage. That's not just muscle damage, all right, that happens in that case. So remember this going forward. We see high correlations with forceps deliveries. Guys, just know this. Everything is jacked up in these sort of bursts, all right? I'm giving you the hot tips, the cheat codes. You're too old for the original Nintendo. And like we would get like a magazine and be like up, down, left, left, right. All right, shit, cheat code. All right, so what you find with forceps deliveries is you will find that occiput and that atlas, they're just mashed together. They are stuck, okay? Now I'm telling you, now bringing it to techniques, so analysis, right? We're talking about understanding what created and formed that subluxation and what it looks like, smells like, and is like, so that we know the best way to deliver the goods. This is why you can't be rigid and say every baby has a subluxation, so they'll get this one technique from me. Learn as many as you can and apply as many as you can in your toolkit. That's your practice. Those kiddos who had really mechanical torsion forceps deliveries, a lot of times, guys, even babies, we'll have to sit them up. We're going to move that occiput. It is jacked. You might need to take a few adjustments in the beginning of kind of sustained contact, unraveling, opening up, kind of, I call it loosening the pickle jar. And then you're going to find when you get into practice with these kiddos, you got to kind of loosen a little bit. And then there comes a time where you kind of grit your teeth and you got to do it. All right? And you'll find those sort of cases show up, especially with forceps deliveries. Okay? Now the other common one that is there, again, C-section. I'll get to two in a second. Yeah, we sure have. Okay. A vacuum delivery, which know this, a lot of C-sections and other sort of deliveries had failed vacuum first. So be sure your paperwork, you're questioning your day one, you're getting into that, because again, it's going to help you hunt down the subluxation. Now we're going to go back, when do you get spinal anatomy class here at Parker? First try? That's a fourth? We guys learned in the first year. Just like DNA and stuff. Okay. That's Palmer. All right. My favorite thing, and it's still this way at Palmer, actually they have the 5D model up there now. It's crazy. Oh my God, I got time for another tangent. And this was my career. I'm a science-based guy. I fell in love with chiropractic because I shadowed a chiropractor, and he was having fun and he was helping people. And I was like, you can help people, you can get sick people well and have fun. You ever been to a hospital? God bless him. Not for me. All right, I'm a fun-loving guy. I shadowed this guy as a junior in high school. I Yahoo'd it because it was before Google. You young freaking people. I feel like, can I just still be adopted in the Geo generation of chiropractors? Like, I feel like I'm not up there. I'm more in here. You just take me for another year or two. All right, so what I'm saying though is, fell in love with it, had fun, Yahoo'd it, found it was all about science, and just had to know this stuff and went into it. So, sorry, now my tangent takes me off track with everything. Pretty typical for me. You understand why I'm good at taking care of ADHD kids? Anybody get that picture? Relatability, okay, the most important thing. So the moms are just like, well, hell, if that guy made it, we might be all right. Okay, that's why the suit coat matters. They think All right, so now though, let me just go back to where I was with that vacuum delivery. Oh, Palmer. They literally gave us a class, right? Squirrel. They gave us a class and they were like, here's 14 different freaking models. of the scientific basis of subluxation. Literally, and I'm a good student. I'm like front row, always paying attention, because it's also the only place I can control my ADHD. And I'm learning, I'm soaking up, I'm like, tell me, because I was halfway through school. This is like a 4th or 5th try class for us. And nobody had told me yet, this is actually what the subluxation does to neurology and physiology. Because that class told me there's 14 different models, like 7-part, 5-part, MOPI, whatever, all this other sort of stuff. And literally the instructor, this is what he was saying to us. We're not really sure which one's right yet so far. I mean, we've been around 110 years, we haven't figured that shit out yet. And so just pick one that sounds good to you and tell people that's what it is. Guys, you can probably tell from me, I'm not I'm as authentic and open book as you can get. I can't roll that way. I can't script. You know, I'm not a big fan of scripts. Even if they were a good idea, I couldn't do them, okay? I can't get myself in that way to buy somebody else's stuff and make it mine. And I don't want you to ever do that either. Don't be a pediatric doctor because it's what Tony Ebel or somebody else does. Be what you want to be. But the root of that is, I finally then, a trimester later, had a friend hand me Chestnut's book about disafferentation, right, and subluxation. And I finally had my certainty that I could just explain to people, listen, subluxation is real as hell. It's really bad, and we do a lot of good to do it. Now, tying that in, though, to what I've been taught to that point about the subluxation really just kind of being this bony misalignment sort of thing, it's actually going to come into play. It's good to know your spinal anatomy and all those landmarks that you had to take all those tests on when you start to hunt down and find these subluxations in your analysis of these kids. So let's think about for a moment here the anatomy of C1 and C2. C1 is called the atlas, right? Because it holds up the weight of the world, the brain and the skull. C2 is called the axis. Why? Rotates, right? It's the spinner. So C1 and C2 have dramatically different anatomy, don't they, than the rest of the vertebrae? They have different joints, they have different bodies, they have different sizes, and especially C2 has this little thing called the odontoid process, right? And where's that little sucker go? Right up inside atlas, right? It's got the dentate ligament, and it's a majorly important thing. So it sits in here, and this is exactly how we explain it to parents, by the way. I literally a lot of times will be standing next to a door in practice. It's exactly like a pin hinge joint. So you've got the pin that sits on top of C2, and it sits right inside C1, and that is responsible for the majority of our rotation of our head and neck. Kind of important. Why? Because we said at the beginning of the day, movement dictates brain function dictates life health. Okay? Vitality. So now we take a vacuum extraction delivery, we put it right here, and we pull north, y-axis, right? Bring the child down the birth canal. They're stuck in there. So we pull them all the way down. Now imagine, and you see, now you're C1, C2 in this delivery, so the doc is pulling here. So what is different also about C1 and occiput? They're pretty well linked up, right? Occipital condyles, those suckers are deep, especially in some kids, right? They're way in there. There's not a lot of, not a whole lot of movement, especially compared to down below, right, the next floor, as C2 to C3 or C1 to C2. So that occiput, that skull, right where, and again, forceps does this too, but I'm telling you, vacuum, if you remember this little clinical nugget, you will get some of the worst cases well by knowing exactly where to hunt down. So they take that and they pull that atlas really basically comes along with the skull. C2, what's at the bottom of C2? Facets, right? Not so much. A lot more flexibility and pliability, isn't there, between the bottom of C1 and the top of C2? But not here. The facets start, and that chain's pretty well interlinked below there, right? So this thing's tied down. This is anchored. The hips, the baby, the body, it's all still in there. So here's what you get with that. Distraction. Then they got to deliver the shoulders, twist. And C2 and C3 and all its other little homies behind it are still stuck in there, and they're pulling that out. So what you find in vacuum extraction deliveries is you will find a massively subluxated C2, okay? The majority of the time in a vacuum extraction delivery, a child will have a C2 primary subluxation, and C2, this is like, you're under the hood here with me, guys. This is stuff we find in practice daily, okay? And we will get research done to track it and stat it and do that. But right now, chiropractic has like 43 cents to do research with, so we're not very good at it, okay? So what happens is we find C2 subluxations, and now again, neuroanatomy comes into play. The old Merrick chart, the old Fuse chart is anything but outdated. It's anything but the only thing. Remember, these are all elements. C2 subluxations will come with the S cascade of conditions. The symptoms that will follow a C2 subluxation will be neurologically, the worst is seizures, okay? And it comes with huge disconnection. If you go back to also your neuroanatomy classes, a lot of the neurospinal tracts cross right at that area, okay? The dentate ligament, the torsion, the dura, everything that is interfered with a massive C1, C2 counter rotation subluxation creates havoc on the connectivity and communication of the brain to the body and the body to the brain. So neurologically, you'll come up with huge seizure conditions a lot of times in those cases. Does that mean that a forceps delivery and an atlas subluxation occiput don't lead to seizures? No. I'm just playing the odds here for you guys, okay? So you'll find a lot of seizures. You'll find a lot of sensory processing disorder. So sensory disconnect, which absolutely feeds things like anxiety, ADHD, and everything else. And then in the earlier years, what you'll really find, the S conditions, they will be sleep-related issues. C2 has a lot to do with sleep. C2 has everything to do with the sinuses. There's even more anatomy there too, and don't be afraid to explain this. C2 also has what? A huge vertebral body. You know what the ENT system relies on? Freaking drainage on the inside, down the throat, and drainage along the lymphatics. If you take C2 and do this, you take the front end of it and you literally clog the drain, okay? And then you take the sides of it and you clog the outer drains, all right? You clog the eave spouts. So now a kid gets ear infection, strep infection. So you'll see a lot of sinus, strep, allergy sort of issues with the C2 subluxation. Atlas primaries tend to be more of the ear infection creator, whereas C2 tends to mess with the sinuses and the throat. Just frickin' geography, all right? And neurology. And then I think those are the main. There's 4 or 5 primary things we see all the time with the C2. Guys, I know I got right into some deep level stuff, and I wanted to leave some time with questions, so I'm going to fly through the rest of this here. But I want you to know this. I want you to work your ass off at becoming a badass pediatric analyzer of subluxation, because it's going to make the adjustment easy. When you have that sort of certainty and experience, do you think then at the end point, do you think I'm worried about the adjustment I'm about to make? Or am I like, giddy up, let's do this, right? Okay, you have to adjust from your toes because you spent enough time knowing how you got there. Most people adjust kids and almost all adjustments from their heels, and they're reactive. They're reactive in their communication, and they're reactive in their delivery. Not me. I work my ass off on the backside, so that when it comes time to deliver the goods and help that kid, first by connecting and communicating, and second by connecting innate, I'm on my toes. I know what I'm doing. So I want you to become such a badass analyzer that literally one day you could actually work this system in reverse order of how it works in your practice. It was actually insane. It was a different seminar. I talked about this like 2 years ago with a group. Some of them were Parker grads. And what I'm saying is, I could put my hands on a baby, and I can tell you based upon their subluxation patterns, with probably about 80 to 90%. Again, not something I've ever actually studied. I'm just making assumptions here, being very honest. But about 80 to 90% of the time, I could reverse that story and tell you what kind of birth they had and whether their OB midwife was right-handed or left-handed, based upon their subluxation patterns, okay? And that's what they are. They're patterns. They're not locations, they're patterns, okay? And I then could tell you, based upon the subluxations they have, I could probably fill out their case history form for you and tell you what sort of things they're dealing with. Because altered neurology leads to altered physiology and end organ, in tissue, in coordination and function, which causes symptoms, okay? So that is where I want you guys to get one. We've already talked about this. Remember, the care plan is a process, and I do want to leave time for questions. I know I threw a lot of crazy stuff at you, left, right, and everything in between. Common mistake number 5. This one's huge, okay? Guys, if I could, every single time, I love, like if somebody makes me answer what technique would you write on a form, like when we fill out to do interns and stuff for schools, right? We have to write down our technique. And if I have to rank them, I would put MC squared, okay, so the tonal technique, as my top one, and TRT probably in the second spot of the batting order. But I'm telling you, then if you went from an MC squared or TRT seminar on Saturday and Sunday, and you learned it the way all techniques have to be taught, mechanical, check, doot, 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 sort of thing, then you came to PwC on Monday and you rolled around with me, you'd be like, that son of a, he doesn't do MC squared, he's just doing some crazy shit. I don't know what that is. Because a 3-year-old nonverbal running around throwing scissors at you with autism kid doesn't exactly hang out there while I go, I'm just gonna come back here. Okay, could you tell me how to do it right? Oh, you don't communicate at all. Okay, all right. Right? I mess with students all the time. And babies, they're good at it. Like you have a baby, you check, right? They're usually supine first. I do this. I'm such a jerk. But when students come, now if you come, you'll know, so I won't be able to do this to you. But I'll literally, they want to learn about technique and all that sort of stuff. So I'll be like checking the baby and going through here, and the students like standing over there and they're like, okay, little baby, turn your head to the right. And then you just leave it awkward for a minute, and then you look to the left, and the baby just look at you like, I don't know. And the students got the same look at the baby, like, I don't think the baby's gonna turn his head. Shit, what are they gonna do? How's he gonna find the subluxation, right? Okay, my point with that story on it is, in pediatrics, you will not have the opportunity to be perfect. A colicky, screaming, spitting up baby is going to be hard to analyze. A raging bull, perfect storm, autism kid who you might have to adjust the first time in their minivan because he's afraid to come into the office isn't going to give you a perfect set of scans and analysis, okay? So do not be perfect. Do not be worried about being perfect with your setup. Just freaking and this is not a cop-out to bastardize anything. Please know that. But there's a lot of cases in real-life pediatric practice outside the classroom, outside the doll, where you can't do most of that, okay? And you have to let your head, you use as much as your head. The last one I'll give you is a tip to kind of cheat code this. And you have to just know that remember the first, there's less and less elements sometimes than you'd like to have, okay? You have less and less information in the toughest cases. Just call it how it is. So a lot of times you just got to let your heart lead. You got to go in there as quick, as confidently, as calmly as you can, because the worst kids in the world that need your help the most are so sympathetically stuck on, they're scared shitless of the world. Except for people that have, such a wuss. I have 3 daughters. I get wussier with every baby girl I had. So when you get into those kiddos, they're the hardest to gain their trust. And they're the ones that when you get it, they never want you to leave. They will literally take your hands. The kids that you think are going to be the hardest to adjust and take care of. In the beginning, they are. But when you don't worry about being perfect, when you don't worry that they're not laying on the table face down perfectly for you so you can follow your flow chart, when you just worry because you know they're subluxated and their life is better with you and chiropractic in it, and if you can just move, again, I'll even break it all the way down the cheat code. Start at the top. Just move atlas, okay? Just get to the side and just go all the way back to dyskinesia. Just get in there, gain their trust, be certain, be on your toes, be calm, be caring, be loving, and then light the shit out of it. that's my, okay? No, I had to turn the tide on that, all right? Just for you guys. You're like, whoa, he's getting serious. I don't make it there for too long. It's also why I have a pediatric practice, all right? Best way to not cry is to crack a joke. But it just takes me to how many kids that I've been blessed to serve that, you know, the rest of the world, they don't let the rest of the world in, because autism is the severest form of disconnection, and your job, you are reconnectors. You are vagal nerve stimulators. You are brake pumping people, all right? Your job, the only way you turn off the gas pedal is hit the brakes. So you got to get in there. And sometimes all of your other stuff, from class, from a seminar, from anything I even told you and can tell you, in my experience, will not be there, okay? Just get there. Just get there and make an adjustment, and don't worry about being too perfect. And this is a last kind of little tip too, and it's perfect. Then we'll have 20 minutes for questions. I do not treat ADHD. I do not treat autism. I don't think I treat subluxation, okay? I find and remove and take care of subluxation. So I don't treat anything. Do I talk about that stuff in my community all the time? Yes. Do I get flack from the land of chiropractors on Facebook who know everything? Yes, okay? And that's fine. They're not in my town. They're not a sick and subluxated kid. I don't need to improve them. I don't need to win them over. And what I'm talking about, though, is I have that language in my community because those are the stations that people listen to. No mom who's never been to a chiropractor is up at 3 a.m. while their baby is screaming with colic, Googling, I wonder if subluxation is related. They know what subluxation is, all right? They know colic, they know reflux, they know that. So they Google that, and you know where I want them to land? On a story that explains how subluxation could contribute to that, okay? So I only talk about subluxation, but I absolutely sometimes let the cover of the book be what they need the cover of the book to be. I only play my songs on the stations they listen to. I say this all the time. I don't take a billboard. Well, I don't use a freaking billboard because it's like taking a Yellow Pages ad out. A little thing called Facebook ads. They cost like 13 cents, all right? And you can blow your practice up with them. And so we employ modern marketing. We'll talk about that tonight, give you tips on that. But I'm never going to take a Facebook ad or a billboard that says, subluxation sucks, vitality rocks, 815-455-8213. Then people will just think I'm a crazy or batshit chiropractor more than I already am, right? Because that's what they already think of us. They don't speak our language. So start by speaking their language. One of the languages they use is symptomatology. When does the majority of the world seek out help? When they're sick. When their child isn't doing well, right? Are we busting our ass to carry the message further, louder, better? Do I want to blow my practice up with well kids? Every now and again, 9 years into this work, do I get a family that comes in, writes on the form to be checked from subluxation? Yes. Do I it's like Oprah. I give them balloons in a car. They're like, you're awesome. Because we're getting that message out there, all right? But the majority of the time, it has signs and symptoms. Why am I talking about it in a topic, in a class where I said I talk about analysis? Because I do not adjust in a manner that says, the kid tells me his stomach hurts, so I just push on T6, okay? We've all seen the fuse chart, the Merrick chart, those sort of things. It's not that easy, but it's also not applicable in some cases, okay? Remember I told you that the interpretation, this is kind of how we wrap it, it's an analysis of everything together. Guys, I listen. I had a practice coach or whatever, something sometimes tell me, don't ever ask them how they're doing, because you don't want it to be about symptoms, you know. What am I talking about? Cubs? Weather? All right, well, this is the first year ever that you can talk about the Cubs and it would actually be a good conversation, all right? But what the hell? I'm a human. How you doing? I don't know. How awkward of practice are we when we start doing these scripts and these things that sound like a good idea in a chiropractic classroom, and then you get in real life and you're like, that was dumb. And why do they do that? Because they wanted to kind of change the philosophy and the understanding of the patient of being like, oh, well, it's not about symptoms. It's not, but that doesn't mean you can't start the conversation there and then lead it. And the other reason, the one I'm trying to bring to you guys today here, the other reason I ask how they're doing is because I know neurophysiological effects really well. And I am a hunter and mapper and CSI investigator of subluxation. So sometimes, like especially with some of the worst cases where you can't do a whole lot of the other elements of your analysis, sometimes you gotta listen and let that lead you. Now again, if somebody has, it's September in the Midwest, so everybody has allergies, right? No, they have apple cider donut muffins and freaking apple cider latte season, all right? That's what they have. Get off your ass and stop house and Diet Coke, all right? Then you won't have allergies. But, right, that's kind of an easy, you know, I soften it slightly to patients. But what I'm saying is, if they have a C2, if they have allergies, that doesn't just mean, boom, C2 on everybody, it's allergy season, right? If they have an upset stomach, it doesn't mean that. If they're constipated, don't just blow up sacrum. Now, the majority of the time, they come in, they have allergies, they have congestion, you do all your other checks, posture, palpation, scanning. I use Atlas Foster temperatures on everybody, every time, pre and post check, to find dysautonomia. Remember I told you those 5 components of the subluxation? Here's what we're looking at with them. But the majority of the time you'll find C2. A lot of times the kids having stomach constriction, stomach sort of pain. A lot of times you'll find them mid-thoracic. Can't poop, having issues with that, toe walking, those sort of things that would trace and find your way to the sacrum. Guess what? Your hands and your head and everything else typically land on the sacrum as well. So that's the wrap of putting that all together. They are all elements. None of them should exist on their own. But the reality of a pediatric practice, sometimes you might need only 1 or 2 because you don't have all of them. All right, so quick review, then I'll shut up for questions. This is our 5 main indicators that we do on every single patient. First, we listen, okay? Every single day, we check in with our patients and we see how we're doing. Again, slippery slope. I don't have time to teach you the whole concept behind it today. That does not mean that the conversation stays in symptoms. In fact, if you hung with us, it's anything but. But because chiropractic isn't for me, it's for them. Did anybody get to, I saw his post this morning. Dr. Durrell was here yesterday. Anybody get to see his talk, right? Or the Just Club? Awesome. His post this morning, that's a beautiful rock star man. He just gets it. Chiropractic isn't for, it's not for us, it's for our community and for our patients. They don't care about disafferentation, right? And dyskinesia. They care, I got something going on, can you help me? So listen, number 1 skill, the number 1 skill, shit, that's huge. The number 1 thing you can develop to blow up your pediatric practice. This is a clinical tip, practice growth tip, everything tip. Become an epic listener. You will find everything you need to know about that child's case history and everything you need to say and do to get them well by listening to the mother first. She will tell you what happened. She will tell you where it came from. And then you follow and then you take care of that kiddo. Just listen first. Don't be so in a hurry to share your script, to share your communication, to share what you were told to say. History has meaning, take it. We are the biggest fans. If anybody has questions on this, I'd love to expand upon that, but I'll fly through it. If we're going to talk about the nervous system, measure the nervous system. The Insight subluxation station is my little homie. We have 2 of them. They are smoking by the end of the day. We tuck them in, we put them under lock and key at the end of the day because literally they are so crucial and critical to our practice because it gives us certainty. They are not just a communication tip. They are not a tool to take to Costco on the weekends with your dry spine and say, look, Billy, that red bar is bad. I'll give you free x-rays and like 13 adjustments for $20 if you come in, all right? That's not what a scanner is for. That's what people who are not, yeah, I'll stop at that. All right. Atlas Foss attempts are measuring again. So what are we measuring here? Case history, what am I listening to? I'm listening for physiology, right? I'm listening for abnormal physiology that I'm going to map and go back to neurology. So you could, if you start matching the D's, I have a different slide I should have put in here where I match the D's with it too. This is going to start to probably hunt down for you dysautonomia. You with me on that? Remember, the autonomic nervous system connects to every tissue, organ, and gland. This is going to measure dysautonomia with thermal scanning. It's going to measure dyskinesis with EMG scanning. We are working so hard to bring HRV. We're like a test lab for CLA in our practice because we see so many kids and spectrum kids. So we are working really hard to bring HRV into the pediatric population. Right now, the main HRV is you have to sit there for 5 minutes. We got it down to 3 minutes. So no baby is going to be like, yeah, I'll hold my hand in there without moving for 5 minutes, or autism can. So we'll get there. Atlas Fossa attempts, we use various ones. We take pre and post checks of Atlas Fossa before. Then, this is the typical stuff, right? 4 and 5 are, that's hopefully you're making your time in the lab, hopefully you're getting on the tables, hopefully you're getting your hands on as many people as you can, and you're rocking and rolling, and you're looking, and you're feeling. Okay, all right, and I'm going to talk a little bit more about this tonight. Do you guys have the opportunity, I think I saw you did one last, do you have mission trips through school that you get to do, or are they all kind of, you just kind of get connected with different? So you don't have a clinic abroad trip that you get to do? Okay. Palmer, we used to. They took it away in a year or 2 ago as well. I guess just thinking for the student component for a second, 4 and 5, remember neuroplasticity, like subluxation, the more, and the same with scans, the more cases you could hear about, the more scans you could run and see, and then just honestly, the more patients, the more looking and feeling. That's why I think one of the biggest issues we have with chiropractic school is your requirements with the number of adjustments and visits you have should be far, 200 was what we needed at Palmer. In a year, that's called Monday at our practice, okay? And so I think we need to, beef that up, but I'll kind of expand upon that tonight. So, all right, we got 15 minutes left. I know I just shouted and yelled and ran around and said a million things to you guys today. That is I also, I teach speaking seminars, just like today, I teach you how not to do it, all right? So, and then you can learn how to be a better speaker by not going through so many tangents and craziness and swearing. So don't show that to my wife, all right? I swore too many times in there. All right, guys, so remember, all that goes together and kind of makes your pie of analysis and elements. So, we have 15 minutes, right? 12:35, 10, 15 minutes. Fire away, questions?